Hello, this is Grace Leon, and I am going to answer the clinical reasoning questions for the PhysDis and geriatric course. Question 37. I chose answer B because it continues with OT services, and you will continue improving the use of the hand. Home exercise can be given while the patient was in therapy before discharge, and I'm sure the home health will continue with work hardening. The next question, I think it says number 1. I chose C, observation of the child during eating activities in the child care center, because I think the first thing you should do is observe the child in their regular environment, and that way you can gather information and see what motor performance skills have deficits, and see the way that he participates in activities using his upper body. The next question I think is 3. I chose the letter B, ask the individual how they spent the New Year's holiday. From what I read, declarative memory, it's like explicit memory, that you recall facts or memories of past events that can be somewhat declared. I thought that answer A, that's kind of like everyday objects, not so much memory. And then answer C was more about orientation. Next question, 58. I chose letter B, perform desired activities in simplified manners to conserve energy. I think this is a method used to help individuals with occupational performance issues. It's the best ways to task simplify using, energy conservation techniques. So that would be the first thing to do. Next question, 61. I chose A because in the initial phase of Guillain-Barré, you gotta address, I guess, the acute symptoms, and includes passive range of motion and orthosis, so as well as positioning and protect weak muscles to prevent contractures, and then you would start with some progressive, resistive, and fine motor activities. So A would be the best answer, or the first one. Question 65, I chose C, fitting of compression garments. Lymphedema results in swelling, and that can be very painful. So treatment begins with fitting of a compression garment, as well as massage, and then the other things can come later. Question 72, I chose B because short memory is lost, and the earliest in Alzheimer's disease, and memory loss with decreased conversation and difficulty with problem solving. So I would definitely want the patient to continue adapting their environment and still have some meaningful life, some purpose. So for sure, being able to still do productive activities and continue participating in things like in the kitchen. The next question is 94. I chose A, decrease inflammation and edema. Taping normalizes muscle tone. It doesn't decrease range of motion, but increases impaired range of motion when relieving pain. I thought that was the best answer. I don't think D is I don't think taping helps with desensitization. So the letter A is what I chose. Number 99, I chose C because I think A and B, you can do it beforehand. ALS progresses, and occupational therapy can start with compensatory and optimize safety, educating the family, caretakers, proper positioning, safe transfers, and maintaining good joint and skin integrity as well. Question 100, I chose B. All of these sounded good, but B to me sounds the most helpful because it allows family to have to be prepared in case the wheelchair breaks, since this is the way that the child goes around and moves around, functional mobility, and for a 2-year-old, that would be important to have as a resource for the family to start getting a good wheelchair vendor and continue with that relationship with them. Question 101, I chose A. Manual edema can be managed through the lymphatic massaging, and you keep it from getting worse. I thought B and C were kind of contraindications for this edema control. Okay, question 102, I thought it was A because it's normal and less invasive, repositioning the pelvis obviously and making sure that they're sitting in the center and in midline. But compared to the other answers, I thought that was the most invasive and the quickest fix. You don't want to add too many things to a chair and make the kids stand out even more. So, okay, question 111, I chose D. Involve them in sanding and staining increasingly large pieces. I thought that this would continue with range of motion. I didn't see why bilateral coordination and the heavier weights. I don't know if he's ready for muscle strength. It didn't talk about increasing muscle strength, but more of range of motion, so I chose D. Question 123, I chose C. Foam tubing around the utensils, again, just keeping it as normal as possible. If that doesn't work, then you can continue to other things like the swivel utensils and weighted utensils, but I would first start with something simple like adapting the regular utensils with a piece of foam. Question 125, I chose A, skin inspection. To me, it just makes the most common sense for checking before you do any prosthetic training. So 129, I chose B, PNF with the cross pattern. So going from the right bottom to the left top, being the left top of the counter. I don't know if it could have been the upper left side of the cabinet, but I thought to keep it simple, I chose letter B. Question 144, perform pursed lip breathing when doing activities. I thought the other ones were just as good, but pursed lip breathing will control COPD regularly when they're engaging in daily activities. So I chose A. Question 145 is C. I chose C because of the bony prominences like the ulnar styloid, the distal head of the radius, and the CMC joint. Because of the fragile skin. The other ones, I guess letter A was mostly in the hand, and then the other one was the volar side of the hand. So question 147, I chose C. To educate the patient on ways to modify and continue doing self-care independently. There's nothing wrong using range of motion and strengthening activities for the upper extremity, but there isn't really wrong with their upper extremity. Yes, that could be done, but really we want to help them return to their life with some modifications because of the knee replacement. And then 166, I chose D. I think that productivity is a high demand, so employers will definitely want to always worry about the numbers of the therapist, and how performance is measured should be known and good to know. So I chose D. Thank you.